Hey guys, how's it going? So today I just want to do a quick overview of testicular cancer. Just give you some background information on, and then maybe in another video I'll talk a little bit more about the details of it. So testicular cancer, it's the incidence is rising here in the United States. We're not really sure why. Maybe we're just finding it earlier. About one in every 200 to 265 people males will develop testicular cancer. The average age is around 33. But 7% of those people with testicular cancer are children and teenagers, and another 7% are the elderly, greater than 55 years old. Um, the American Cancer Society estimates about 8 to 9,000 new cases in the year 2017, and several hundred deaths as well, about 400 deaths this year. So let's talk little bit briefly about the testicles. They have two main functions. The first one is they make androgens, which are male hormones. A lot of people know like testosterone, that's one of them. And then the other main function that they have is they make sperm, and this is used for reproductive purposes. Risk factors of testicular cancer. Obviously, any previous history of testicular cancer puts you at risk for having another testicular cancer. Family history is also plays a role. If your brother had testicular cancer, you have an 8 to 10 times greater chance of having testicular cancer than other people. And if your father had it, then you have about 4 to 6 times more risk. Another risk factor is cryptorchidism, which is when your testes as a fetus are actually kind of more in the midgut area, and they descend. So if that descension takes place later in life, it doesn't take place on time, then that is also a risk factor. Also, Klinefelter syndrome is also another risk factor. In terms of screening, the United States Preventative Screening Task Force, they actually recommend against screening for testicular cancer in adolescents and adult men. They say the evidence isn't there for the benefit. The American Cancer Society, on the other hand, it's a different organization. They recommend screening as part of a routine cancer-related checkup. They do not have an official recommendation in terms of self-exams. If you do want to do a testicular self-exam, the main way to do it is you basically hold the testicle between your thumb and fingers with both hands and roll it gently between your fingers. And all you do is basically you're feeling for any hard lumps or nodules or any changes in size, shape, or consistency. That's it for now, and I'm going to make another video hopefully about further stuff about testicular cancer. All right, thank you. Bye.